So, hello, good evening, everyone. Today, we are having with us the pleasure to invite Dr. Dominik Zurek, and he's into a training program in Poland. And he passed his FEBU exam, the Fellow of the European Board of Urology Section 1 exam this November. And today, he's going to share his experience. He was with us with the FRCS course, and with the FRCS lectures, he benefited and he passed the FEBU Section 1. So, let us hear from you, Dr. Zurek, and congratulations on your success. I want to hear from you. How did you prepare? And could you please introduce yourself a little bit? And then we will talk about the FEBU preparation.
Okay. Hello, everyone. It's a very pleasure for me to join this meeting. And yes, that's correct.
Thank you for your time.
Thank you. Too. I'm a medical doctor in Poland, and right now finish my residency of urology in Bielsko-Biała in Department of Urology. And I just passed the written part of FEBU exam because in Poland, the FEBU exam, it's if you want to be a specialist of urology, you must pass it because it's like final exam. There is no other exam in Poland.
Okay.
So I'm maybe not so good in public talking, but the road of preparation cross with Dr. Goyle. So
thank you.
And I'm very thanks for him for what he doing, and so maybe it will be helpful for someone.
Okay, so I have a question here. So you said that FEBU is the exit exam, kind of final exam for the training there. So could you tell me how long is that? What is the duration of the training in Poland? And is it uniform in different countries in Europe, or is it different in different countries?
I think it's not exactly uniform, but probably it's similar in most of countries. In Poland, we have 6 years of training. And when you finish your study, you go for 1 year of some practice with all medicine, with general medicine, many other departments. And after that, you choose what you want to do. If you want to do urology, you must pass very good final study exam because it's kind of prestige, I think, specialization. And you doing few years ago, or maybe a little more, you must be a surgeon at first, but now the part of general surgery is a part of all the specialization. So you're making this 6 years from where most time you are in your department. Sometimes you go for surgery, some other transplantation department. And when you finish it, you go to EBO exam, written part. From now, it's in November. And then you go on July to some speaking part or to exam in UK. That also you have 2 parts. But I think it's few differences about preparation, because the main source for FEBU exam is urology guidelines, which is every year a new part and some changes in there. And about this preparation, because I think I will talk about it. In my way, I start to reading guidelines. I have some, how to say, basic from the study, from my work, but when I read at first guidelines, which I read once during these 5 years of my working, I feel that it will be hard to prepare from this, because the guidelines is like only about the management of diseases and the other. And sometimes, in my case, but maybe probably in yours also, some parts when you, for example, don't have good basic, and you will don't have read it in guidelines because they write it only about the management, only about the cure, not about pathophysiology, not about anatomy. But in the exam, it's sometimes necessary to know that. So when I started reading guidelines, I'm in disaster because I don't know some parts, for example, oncology, because in my department, I working in main with patients with oncological profile. So when I read it about oncology, it's how to say, maybe not so simple, but clear for me. But when I read about, for example, andrology, I don't have good basic. So I start to finding other sources.
Right.
And unfortunately, at the end of my preparation, which is something like 3 months, 3 months when I limited my working, no going so many hours to work. At the last month or last 3 weeks, I discovered that Dr. Ankit exists doing very good stuff, because I'm looking for some changes in guidelines 2024. And I found perfect videos about bladder cancer, also about probably metastatic kidney cancer and prostate cancer. And when I found it, I write to Dr. Ankit and he shared me access for all the course, all the videos. And that was game changer in my preparation. But also I used this Oxford handbook, which is very good. But before I discover it, I buy a book which is called Urology Last Review,
Yeah.
which probably you know, and I have few things about it. So probably I have it right here.
Yeah.
I think it's very good, but it depends what you expect, because it's not the source which can you use only and have a good mark. It's my opinion. But when you have problem with basic, it will be good to read it at first. Then go somewhere else to the guidelines, to the other, and take reviews from this. And the in the end of your preparation, or in my preparation, I know a lot. I think I see a little mistakes in this book, but it's also the perfect source, because it's very quick review. And also with these books, you have about oncology something like flow charts, which is something like that about it's 7 parts about all urology cancers. And I think it's very good. It's hard to read it once and know something about it. But when you look at this every day, this 1 month or 2 months,
Yeah.
you see other things at all the time. And I think it's very good. So about the sources which I use, it's urology guidelines. It's
Yeah.
main source. But also these flowcharts I print on good. At, at the beginning, I also read something which is called urology cheat sheets, which is made from some doctors from Spain, probably. And I think it's also very good, but also it's maybe not so perfect source, but at the beginning and for reviews, it's good, except of this, which is not so actual. So when you know something about some part of preparation, you will see it. So it's good.
Yeah. So
And
what I understood is for someone who is preparing for FEBU,
yes,
the main thing is the core of preparation is European guidelines, and they can
oh
use
yes, of course.
the last minute review. But then when you are reading last minute review, there might be some mistakes. You can understand the mistakes only if you have your core knowledge, your basic knowledge strong. Then you can identify, because
Yes.
any book is a review book. There is a possibility some questions might be wrong. So you can identify them only when your basic is strong. And
Oh
then
yes, yes. I think yes.
cheat sheets. The cheat sheets are good, really. They are also standard. Flowcharts are there. Again, they are very abridged and very concise way of understanding a topic. So these are all from the European sources of preparation for the FEBU. And you also said about the Oxford that you read. I have a question. You attended the classes, they were FRCS based. Mainly the classes that I conduct are FRCS based. But then, how common were the scenarios or were the questions, MCQs that we were discussing in the classes to your exam? Did you find much different in the pattern of the exam or in the standard of the questions, or do you find the standard of the question is almost the same? Like
Mm.
somebody preparing for FRCS can easily pass FEBU. Somebody is preparing for FEBU can pass FRCS.
Oh, I think it's quite similar, but there is some differences. But most important, which I have from your course, is the way how to look at this question. Because what you say many times that, for example, I see some question and I think, oh no, I don't know about it. What is this question? But you can rule out this 100% bad options, and you, as you said, at the last, in most cases, have one or two answers. And I made it like this. For example, in this edition, if I can say something about the exam questions. For example, I have one question about penile cancer. From the answers, what is the best diagnostic tool of the lymph node metastasis? And they, in option A, said unilateral modified lymphadenectomy. In second, sentinel biopsy, lymph node biopsy. Also, that on the site of the tumor. At option C, they said radical bilateral lymphadenectomy. And in option D, there is no need to do surgical diagnostic because you can only see it in imaging examination. So this looks like a similar question, but the most of candidates said that, for example, option A or B. But I remember from your course that you said that we should always check two sides. Radical lymphadenectomy, it's not gold standard, but from these options, it's the best. For example, like this, it's I think it's very similar to the question that you show on the course.
I think if somebody has clear concepts, then doesn't matter whether he's appearing for FEBU, doesn't matter whether he's appearing for FRCS or any board exam.
Yes,
If your
yes.
concepts are clear, you can easily approach any exam. You can easily approach any MCQ, any single best answer questions. Any exam is just a format, but then your concepts should be strong, your basics should be strong, and you should be able to apply those basics in solving the questions and eliminating the options. Then you can easily appear for any exam with the same knowledge that you have.
Yes, I agree that it's very similar. How to look at this question? It's MCQs, so it's.
So
I
what's your
think
message? What's your message for those who are appearing in the subsequent exam? When is the next exam? Is it November?
yes, there will be November. So
And
my
second
message,
is in June.
my message, I think be regular, join Mr. Ankit course,
Thank you.
and I think this schedules what you show there, it will be very good. And if I have one question, because it's for me, it's other preparation like on my study, because I have 3 children, I have work. There is no time to sit in front of table and have silence, peace.
Right.
But you must do it. But you should have 3 months of focus only on this exam. And before it, it will be good to read one time of the urology guidelines, even if you don't remember everything what you're reading, but you will know what is about it. And also, it will be helpful if you want to be a FEBU, try join of Europe, which is the education course in Prague. I will trying, but I'm not getting access. But my friend share me some materials, and I think it's also very good. But at the end of preparation, you must know something before it, because
Right. So it's a 7-day course, right? It's a 7-day intensive
it's
course.
probably five.
Okay, yeah.
5 day course. They show many things
Yeah,
which
so they discuss the entire guidelines in details and you understand the core of the
yes,
urology. It's
yes,
mainly for the
but
people who are into training and who has some idea about the urology, then only you can benefit from that. If you don't know anything and
yes,
you go for the course, you will not understand.
and I have only two last messages. That one is about when you want to be a FEBU, you must one time go to the in-service exam, which is exam in which you can take part on first, second, third year of your specialization, and there is no going on with this mark of this. The questions from there, you will have your result and some comments of these questions. There are not the same like in the real exam, but they show the way of the hottest topics of in this year, for example, in
It's an
guidelines.
online exam?
For example, what?
It's an online exam?
Yes, it's online exam. Yes, and it's something like to know the formula and something other. But the topics, for example, in this year, they ask one question about the new classification of Bosniak, and it's very simple. But when you read it, you can feel something like that. That probably they will ask more hard question, but from this
Yeah,
uh,
yeah.
this this topic.
It's like a
And
mock exam.
yes, yes, there is like mock exam, of course. And so this is in service exam, and you can even buy the books from the last exams on the official page, and it's very useful about the MCQs and the second message, what is in my opinion not very useful. So the recalls of last year, because there is how to say, uh, I think that few person write it. They write what they think that is good answer. They sometimes don't remember it very clearly, and there is problem because
Right.
you read it and you think when you know a lot of things, you see that it's not good answer, and nobody corrects it. So
Right.
official questions, yes. Uh, not not very good recalls, not not use
Yeah.
it.
Yeah,
And
perfect. That's a
I
very
think
good message. That recalls are not reliable. Don't just blindly believe the questions which are available on the recall PDFs, because the answers might not be right. The options there might not be the exact recalls. They're just a way somebody has thought, okay, this was us, then somebody has made a PDF out of it. It is not absolutely reliable that this is the question for the EBU. Might not be the exact question for the EBU. And
yes.
Oh, thank you so much. Do you have anything else to convey? Because whatever you said, definitely anybody who is going to appear for the FEBU exam is going to apply all these things that you said, and they're going to benefit from this message that you are sending. So, one more thing, I had a question. So, you said the training program in Poland is 5 years, and then when is
Six.
6 years? So, when do you think when a candidate is eligible for the Section 1 FEBU for the Part 1 FEBU? At the end of the training, or is it can they appear at 5 years also?
No, you can it's 6 years of training, and you can get participation of the part one at the first day of last year.
Okay.
But the second part you can take only after finish your training. So in my example, I finish it in February. So I take part right now, and the second part in June. But I probably it's something like that, because my training is a little bit longer, about some I don't know, something like 2 months. But in last year, I can take part in November, but I won't do it because it's too long time break before.
Yeah, so it's good to keep short break between your part one and part
I
two.
think yes. I think yes, but and also in FEBU that this part one is more difficult than part two.
Yeah,
So it's good to have a good note, I think, and also you will have a good basic for the part two. So as you said in one of your movies, that you should not think about part one, part two. You should doing your preparation for all the topic,
yeah,
all parts from the
right.
beginning.
Absolutely. So don't think whichever exam it is, it's always in parts. So don't think that your first part is different and your second part is different. It's always the same continuation. So if you keep a lot of break between your two parts, the rhythm breaks, the flow stops, and you start losing confidence, and you again have to restart from the beginning. And that takes a lot of effort when you have to restart everything. It's difficult. So it's always better, like Dr. Dominic did. I really appreciate the way he is preparing and his success in the first attempt for the FEBU Section 1. It's a great achievement. Congratulations, Dr. Dominic, once again, and wish you all the best for your Section 2 in the upcoming in the next year, and hope you pass that in the first attempt as well.
Thank you very much. It was very honor for me, very pleasure, and I hope that we will meet in some of your courses before the June.
Sure,
So
we'll meet again, and we'll probably meet in the some conferences as well, in the European conference probably.
yes, yes, it will be very great.
Yeah,
So thank you very much.
thank you so much for your
Have
time.
a luck, everybody who will join.
Right.
It's great to be urologist. It's the best part of science in the world. So have luck. Thank you very much.
Yeah, all the best, everyone, and congratulations, Dr. Dominic, and see you soon. Okay, take care.
Bye.
Bye.